How you can reduce your risk of premature birth. Please click like and subscribe if you like this content. It's not easy for the healthcare team to discover why some babies are born prematurely, but there are steps that can be taken that can slightly reduce your risk of premature birth. Premature birth and managing your weight. Premature birth and staying active. Being physically active throughout pregnancy will boost your overall well-being and reduce your risk of conditions such as diabetes and preeclampsia, which can lead to premature birth. Unless you've been advised otherwise due to specific health problems, it's a good idea to do something active every day. This doesn't have to involve organized exercise, such as an antenatal fitness class. Any activity you do in your daily routine counts, including walking. If you have been diagnosed with any of the following conditions associated with premature birth, please consult with your healthcare team before starting a new exercise plan or embarking on activity. Waters breaking early, PPROM. Persistent bleeding. Intrauterine growth restriction, fetal growth restriction. Placenta previa after 26 weeks. Cervical stitch, cerclage. Gestational diabetes. Premature birth and your mental health. Women who are stressed or depressed seem to be at higher risk of giving birth prematurely, but it's not clear why. It could be because they are less likely to lead healthy lifestyles. Mental well-being is difficult to assess, not least because we all have different stress thresholds, but some factors linked with psychological distress have been linked with premature birth too. Premature birth and smoking. Smoking while you are pregnant will harm your growing baby, and increase the likelihood of problems in your pregnancy. Smoking has been linked with premature labor, and the more you smoke the more likely you are to have your baby prematurely. Cutting down or stopping smoking is one of the most positive steps you can take to reduce the risk of your baby being born prematurely. Smoking is clearly linked with premature labor, and the more you smoke the more likely you are to have your baby prematurely. Premature birth and alcohol. Drinking alcohol during pregnancy is known to be a risk factor in causing premature birth. Giving up completely is safest, but if not, alcohol intake should be limited to 1 or 2 units once or twice a week. Premature birth and drugs. Taking recreational drugs when you're pregnant can harm your baby and could increase the risk of premature delivery, so seek help to stop now. Substances such as ecstasy, cannabis, cocaine and heroin could harm you or your baby during pregnancy. Most women who use recreational occasionally often stop once they realize they are pregnant. However, some women may have developed a dependency and carry on using throughout the pregnancy. If you have developed dependency, it is important to seek help. Why taking recreational drugs can risk premature birth. It's not just the chemical content of the drug that can increase your risk of premature delivery. Drugs can enhance mood or alter your perceptions, so they can impair your judgment and result in you making lifestyle choices that can increase your risk of premature delivery. Other risks include your baby suffering withdrawal symptoms after birth and other health and developmental problems. Using medicines and during pregnancy. If you use any medication, always check first that it is safe to use when pregnant. Even some painkillers such as ibuprofen are not recommended during pregnancy. Tell your midwife or doctor if you are pregnant and are taking medication for any long-term conditions. If you are using any other legal drugs without a prescription, for example if you are dependent on painkillers or sedatives, you could be doing serious harm to your baby, so seek advice as soon as possible. Other health problems. If you use any medication for a pre-existing problem, for example thyroid disease, diabetes, high blood pressure, heart or kidney disease, always check with your specialist as soon as you know that you are pregnant because some of these problems require a slightly different approach during pregnancy. Premature birth and infection. Many types of infection are associated with premature birth. Some infections can have specific effects on a pregnant woman or her baby, but any infection can compromise your immune system, making you more susceptible to further health problems for you or your baby. How to protect yourself from infections and viruses. Get treatment for sexually transmitted infections, STIs. STIs such as chlamydia, gonorrhea, syphilis and genital herpes may affect your baby. If you think you or your partner have an STI, talk to your healthcare team or go to a confidential genitourinary, gum, or sexual health clinic. Seek advice about HIV. This can be transmitted through sexual contact or sharing needles if you inject drugs. Even if you are carrying the HIV virus, the right treatment can greatly reduce the chances of it being passed to your baby. If you are in any doubt, get a test and talk to your healthcare team. Avoid animal-borne infections. Always wash your hands after touching animals or their bodily fluids. If you have a cat, avoid contact with their poo, for example, when changing the litter tray, as it can carry the bacteria that cause toxoplasmosis, which can be harmful to your baby. Wear gloves when gardening in case there are traces of cat poo in the soil. Avoid contact with sheep, pigs and rodents. Prevent food poisoning. Avoid or limit certain foods because some may contain bacteria that could cause health problems for your baby. Be careful when you are preparing, storing or eating food. Wash your hands thoroughly before and after touching food, don't eat foods beyond their use-by date, and disinfect any utensils or surfaces touched by raw meat or fish. Improve general hygiene. Pay more attention than usual to washing your hands after going to the loo, before eating, after changing nappies and before touching your mouth. Look after your teeth and gums. It might sound odd, but scientists have found a link between tooth decay, gum disease and premature birth, suggesting that inflammation and infection in the gum may be associated with premature labor. The experts agree that this probably does not directly cause premature labor, but it's another good reason to practice good oral hygiene. If you have dental problems during pregnancy, it is worth mentioning them to your healthcare team. Dental care is free when you're pregnant, so take the opportunity to keep your mouth in tip-top condition.